be talking about the trochlear nerve, Schwannoma, and the trochlear nerve, of course, is cranial nerve number 4. And so in any patient who has a chronic and progressive fourth nerve palsy, you should be worried that something is in there pressing on the fourth nerve. Of course, most fourth nerve palsies are benign, and they're acute, and they get better. Traumatic, ischemic fourth. So the first thing you got to know is it isolated or not? So if it's an isolated fourth, it's acute and resolves, you don't have to be worried about the schwannoma for that one. It is the chronic and progressive fourth that did not resolve that you have to worry about. And so you should watch the video on fourth nerve palsy and the 3-step test to get to the diagnosis. But assuming your diagnosis is correct, an isolated cranial nerve 4 palsy, one of the things that could be causing a chronic and progressive course is neoplasm. And that neoplasm is schwannoma. It derives from the Schwann cell. And so because the fourth nerve is a peripheral nerve, it can get a schwannoma. And the reason it's missed is the fourth nerve has a nucleus, it's crossed, and then it has a cisternal portion, an interpeduncular portion, and then a cavernous sinus and an orbital portion. Most of the schwannomas are cisternal, which means it looks like a little bump like that right there. If you don't give the contrast material, you won't see it. If you don't use special sequences to follow the entire course of 4, you won't see it. And so you're going to have to direct neuroradiology to the location that you think the lesion is. Otherwise, they're going to miss the schwannoma because it's only this big. So chronic, progressive, isolated fourth, MRI with contrast, follow course of 4, and look here. The cisternal portion for a little tiny enlargement. Schwannoma is usually benign, even though there are malignant schwannomas, or they can transform to malignant. Most of the time, the patients don't do anything or need anything. Observation is fine, serial imaging. But if it's getting bigger, has mass effect, or is causing other neurologic deficit, we can use the stereotactic radiosurgery, or you can take it out. But if you take it out, you'll get a fourth for sure. So you can debulk the lesion, subtotal resection, you can treat it with radiation, or you can do nothing because it's benign. A lot of people just choose nothing. And what that means is if they have a chronic and progressive fourth, they can have surgery or prism, but not intracranial surgery, strabismus surgery. You should know that the trochlear schwannoma presents as a chronic, progressive, isolated fourth, and that the imaging study should be directed at the cisternal portion of the fourth nerve on the side that's involved, and that if it's a mass in the nerve, intrinsic to the nerve itself, it's likely to be a schwannoma.